Hello, this is Hyatt Regency, CVI 2019, Denver, Colorado. With me is Maheedhar Gedela. He's a General Fellow at the University of South Dakota, and he's giving a very delightful presentation about complex intervention for mitral valve. Hi, Maheedhar.
Hi, Dr. Chadi Alraies. Thank you for having me here.
Yeah. So can you tell us what you're talking tomorrow?
Sure. So my talk is about complex mitral therapy. So you all know that the field is like so exciting, and they're like emerging technologies. And in relation to the TAVR, when you are doing any interventional mitral valve, it's an entirely different animal, because the mitral valve is like so complex structures anatomically and the way it behaves during cardiac cycle. And also a lot of the people are undertreated for this mitral regurgitation because of perceived risk of high surgical morbidity and mortality. So for them, the percutaneous interventions are the best we can offer for them. So I have to say about there are transcatheter mitral valve repair in which the mitral clip that was approved by FDA, and recently in the same category the Pascal device was approved earlier this year, and these devices work leaflet to leaflet repair, which is the traditional alveolar stitch. So the COAPT trials showed that these patients benefit morbidity and mortality standpoint, and in the same line there are several devices that work on the mitral valve annulus, and also they work on the cordal repair techniques, and then the LV size reduction. And when it comes to the transcatheter mitral valve replacement, the interest is more in mitral regurgitation, and also in people who were previously operated for their mitral valve regurgitation in terms of valve in valve, valve in regurgitation, and mitral valve calcification also. So the trials are mostly early feasibility trials, but the results look very promising, but we need more long-term data to give these kind of device therapies to people who require from the mitral valve disease standpoint.
So you came across, you said, new devices. So, but for some reason I feel the therapy for mitral valve is way slower than the aortic valve. Is it because we didn't pay attention to the mitral valve, waiting for the aortic to take off, or because really it's a complex valve and really it takes a lot of work?
Sure. Yeah, as you mentioned, first of all, it comes with the anatomical complexity of the mitral valve. It's not as circular as the aortic valve. It's like a D-shaped valve, and during systole it size decreases, and diastole the size gets bigger. So it's like so dynamic, and it gets exposure to like high LV systolic pressures. And also previously the studies showed that people who develop mitral regurgitation, if their surgical risk is high, and these are the people who don't get the surgical treatment because of extremely high risk, because after they get surgery their LV function further dropped. But in case aortic stenosis, if you put a valve, you see the next day that the EF from 30% goes up like even 50%. That's not the case with mitral valve replacement or like mitral valve repair.
So this is really exciting. I mean, it's coming up on coming therapies for mitral valve. Please watch this video and others on CVI YouTube channel, and also watch the presentation going to be given on the website of CVI, Cardiovascular Innovations.org. Thank you. This is Chadi Alraies from Denver, Colorado. Thank you, Maheedhar.
Yeah, thank you so much.